Hello there, Dr. Chellam. Have you ever had a problem with food and you walk around telling people I eat clean, but I still seem to have issues? Well, this conversation is for you. I am connecting with Melanie Rogers. She's a dynamic speaker, she's an educator, she's a publisher. Above all, she's the co-founder and president of the International Association of Eating Disorders Professionals. Now, what has eating disorder got to do with disease? We understand anorexia and bulimia, but do you know about disordered eating? Well, we delve into that very subject in this conversation. Why diets don't work. We all know it doesn't work, but why don't they work? What is clean eating? What is veganism? What is a ketogenic diet? And do you know about orthorexia? I know many of you have searched that word and know what it is, but we delve a little deeper. So tune in to this conversation, remove all distractions, share this conversation with someone whom you believe will be helped by it, and don't forget to subscribe to our YouTube channel, because when you support us, we're able to support you in your journey to health. Take care. Welcome, everyone. I'm Dr. Chellam. Welcome to another installment of our podcast. You might have seen in the last few, or you might have heard in the last few sessions, we've been talking a lot about food and our emotional connection to food. And today I have another very interesting conversation with Melanie Rogers, who is certified in eating disorders. She's actually a registered dietitian, and we're going to talk to her about her evolution. And there's a lot to unpack in this conversation, because it was the first time I have seen two different ways. ED, which is, of course, I would, as a medical professional, will call it erectile dysfunction, but it's an eating disorder, versus DE, which is disordered eating. So I'm very excited to have this conversation. Welcome, Melanie.
Thank you so much, Dr. Chellam. It's a pleasure to be joining you today.
Awesome. So let's dive right into eating disorder and disordered eating. I mean, that's the first time I've heard disordered eating. Tell me a little more about the difference between the two.
Well, they're on a spectrum. So, the general public is probably aware of eating disorders. When we think of eating disorders, we may think of anorexia or a very, very underweight person.
Yeah.
Actually, there's anorexia. There's also bulimia, which is when someone overeats but then usually throws up afterwards. And then there's something called binge eating disorder, which is the most common of all the eating disorders. And that's when someone might overeat either because they're restricting a lot or due to emotions. And right now, during the time that we're in right now, a lot of people are feeling a lot of emotions. There's a lot of emotional eating, which may actually then lead to binge eating. And there's no purging or compensatory behaviors that go with binge eating disorder. And so therefore, as a result of binge eating disorder, we may see clients' weight trend up. Not for everyone, but some. So those are the three main eating disorders that maybe people have heard of. Now, if you think of this on a spectrum and you think of disordered eating, what is disordered eating in relation to eating disorders? It's similar types of patterns around food and body image and exercise, just with less intensity. But it doesn't mean that therefore they're not serious. So what we see happen often is that people may feel, gosh, I'm going to take this opportunity right now during quarantine to get really healthy. So I'm going to eliminate fats, or I'm going to eliminate carbohydrates, or I'm going to maybe take out meat products, or whatever it may be. And that's all very well and good. The motivation is to be a healthier version of themselves. But then they notice they start to get really obsessive about it. And then they start to be thinking about it all the time. And then they may find themselves weighing themselves a lot more than they usually did. And then they may find themselves, maybe I'll cut this out, maybe I'll cut that out. Maybe they're over exercising. And so what starts out as a simple change in diet or exercise or health routine starts to take on much more time, thought, space, energy, and it starts to get obsessive. That's disordered eating.
Mm.
The relationship with food is no longer neutral. There's a moral component to it, good foods, bad foods, and I'm therefore good if I eat these foods, but I'm bad if I eat those foods. And so if you start to realize that you're thinking about food choices, calories, weight, body image a lot more than you were before, that's a suggestion that things are getting a little bit obsessive. Does that help to think of it on a spectrum?
Perfect. It
Yep.
does. On one end, it is a medical condition. On the other end, it's a religion. No, I'm just kidding. No. On the other end, it is almost you forget that this was just a healthier option, but now it's becoming almost like obsessive compulsive. You're becoming a fanatic when it
Yes.
comes to your choices of food.
Yes.
And if fanaticism or whatever you want to call it is not good in any field, because
right.
then you're becoming judgmental. And once you get judgmental, you get to be unhappy. And then you get to alienate yourself, and it just becomes it's a real spiral. I hear what you're saying, but let me ask you this: how did you get into this, and how did you get to? Because a registered dietitian usually just talks about whatever the guidelines, the American Heart Association, obesity. I don't know if there's one for. I think bariatric surgeons have a registered dietitian. What was your interest, and how did you get to see the spectrum? And is disordered eating a new trend? Because the AIP diet, the ketogenic, the vegan, the plant-based, whole food plant-based, all are things that I've seen in the last probably 5-6 years.
Yeah.
Really becoming louder. So is this something that you saw or evolved in your practice? Explain a little more the history behind it.
Sure, absolutely. I'll answer the last question first, and then I'll go back to how I got into the field, if that's helpful.
Sure.
I think you're absolutely right that we're seeing. So, diet culture has been around since almost over 100 years, when there were references to dieting and weight, and cocaine was actually promoted as a medication to take for weight management, etc.
Mm-hmm.
So this has been around for a very long time, but I think, when we really started to see it kick up was when my grandmother was younger, actually, when we came out with low sugar or no sugar, tab soda, all of that good stuff. So there's been a progression of these types of diets, from sugar is bad to fat is bad when we went through the fat-free phase. Then carbohydrates are bad and everyone's avoiding carbs. And so there are these different phases. But also what also started to happen, and this is through education of the public, is that we went from being reactive with our health, whereby, we live our life, we do our thing, and then we get sick, and then we might make lifestyle changes to address, high cholesterol, or I had a heart attack, so now I'm going to start to eat in a different way and do my walking. I'm thinking my grandfather in his era when I think about that. We went from that model to being more proactive and about wanting to be healthier from the get-go and prevent disease as a society. And I think as a result of that shift, transparency also around everything to do with how our food is sourced, and disease, of course, has led to this idea of healthful eating. And as a result of that, and therefore not being a diet that you might go on for a short period of time, but more of a lifestyle choice, I think as a result of that, we've then unfortunately kind of opened up an opportunity for more disordered eating. And disordered eating meaning that your relationship with food is not neutral, it's very loaded, and it starts to get obsessive and causes distress, right? And so that in and of itself is certainly not helpful or healthy. So I would agree with you there. And hence we've seen a lot more. We started with vegetarianism. Now veganism is very, very popular. It's the number one, third year in a row that it's the number one food trend. And of course, orthorexia, which doesn't have its diagnostic code just yet, but we see it enough, Dr. Chellam, that it has its own name, orthorexia, which is kind of perfect eating, clean eating, etc. to an extreme.
I love the word clean eating. When people call me and say I eat clean, and I'm like, I still don't. And one of my nutrition coach who works with me, Marina, she said, unless they're washing all their food with soap, I don't understand what clean eating is. Right?
Exactly. There's a lot of euphemisms that are used now, which really means low fat and et cetera, et cetera. So that's a little bit of what I see as the progression of disordered eating through the decades. And then how did I get in this field? Well, the average nutritionist or registered dietitian such as myself, the average healthcare professional, none of us get training in eating disorders. So it was not actually something I was thinking about going into. But as a registered dietitian, I was very interested in, of course, obesity and the obesity epidemic that was being spoken about as I was doing my training. And I thought, as an RD, my goodness, this will give me job security to know more about this particular very big concern in our population. Let me get more training in this. So actually what I did is, I'm originally from Australia. I came over to the States, and I specifically came to New York to do my studies. I did a master's degree in clinical nutrition at New York University. And I came to New York because there's an obesity research center in New York City. And I wanted to be close to the research, and I was hoping to possibly work there so that I could learn, as the research is coming out. And in fact, I did. I interned there at the Obesity Research Center, and then I worked there for a couple of years on some research studies. And it was while I was there, Dr. Chellam, that I was introduced to, obviously, obesity, and leptin had just been discovered at that time. I'm aging myself, but that was 20 years ago. But what was fascinating is that they were doing studies and offering treatment for something called binge eating disorder. Which conceptually I knew what that was, but we didn't have a diagnostic code for it back then, and the general public certainly didn't know that it was actually an illness. And it was a multidisciplinary team approach because eating disorders are biopsychosocial illnesses. That means there's a biological piece, there's a psychological piece, and there's a social piece, and there's actually a genetic predisposition. So the team was comprised of a medical doctor, a psychiatrist, a therapist, and a registered dietitian, and a sports physiologist. And I was blown away because I love nutrition and I love biochemistry. That's my background. But I loved the behavioral psychological piece as to why people do what they do. And in this case, why people do what they do with food and their health. Even when they, I want to be the healthiest version of myself, but I'm doing this, and that cognitive dissonance, like, what is that about? And so this presented more of this challenge from a multidimensional aspect, and I just loved it. So that was how I got introduced to eating disorders, or binge eating specifically. I started going to conferences to learn more about it. And of course, I had heard of anorexia and bulimia, but I didn't realize there was so much overlap. And next thing you know, as a registered dietitian, whether you like it or not, because people are coming to see you to help with their relationship with food, I realized that so many of my clients either had an eating disorder or had aspects of it, i.e. disordered eating. And it blew me away. So, and then I just got hooked. And then full disclosure, I had my own struggles with an eating disorder many years before and fully recovered, but which is what is typical about the illness, Dr. Chellam, is you're in complete denial about the severity. So I never acknowledged that it was an eating disorder. I just thought it was like maybe orthorexia with a lot of excessive exercise. And then through various things, I was able to, thank goodness, fully recover. But it never occurred to me that was an eating disorder. It was only in retrospect I was able to see it was. But why I'm bringing that up and its relevance is, as I started to work with these clients, I realized I understood the headspace because I had been there with the constant thoughts, the rumination we call it, when thoughts just go over and over, and the anxiety and the cognitive dissonance. And so that gave me a very unique lived experience insight, which I never disclosed to my clients because their treatment is not about my experience per se. It's about what does the research tell us are the best methods for treatment. But I got it. And I think it's allowed me to have empathy and ask questions at a level of nuance that I may not otherwise know to ask. So that's how I've gotten here, and it's my great passion. I absolutely love it, and you know, there's a lot of work still to be done. You know, only 10% of the population of those who are diagnosed with an eating disorder, Dr. Chellam, actually ever reach out for help. So 90% of people go through life struggling with an eating disorder, which blows my mind when you think of the distress, the pain, the health conditions that develop. Yeah.
This is the same statistics with any health issue, right? Most
Is
people
it?
struggle. They struggle a lot. I would say 65% of the folks just don't look for any other option other than what their doctor tells them. And sometimes the conversation with their doctor is not even complete for the doctor to get like a screening study. Like, for instance, sleep apnea, we can completely miss that unless we do the screening study. In men, we do prostate hypertrophy screening studies. Same thing in women about breast health and so many other things, or domestic violence. When you look at the age group, would you say we should probably introduce a screening questionnaire at a specific age group, or this is just right across the board? Do you see like a peak at certain ages and then it goes down? Is there somewhere we could introduce this as a part of their well-being?
Yeah, absolutely. I think it needs to be a part of the well-being, because the misconception is that eating disorders are for adolescents. So they happen during the teen years, you're done. But the reality is, yes, that is a peak time for development. But what we also know is that it's a peak time for disordered eating, which then, as life becomes more and more tougher and more responsibilities as we mature to become young adults. We graduate from college, that's another life stressor. We start a career, it's another life stressor. We get married, we have kids. So we're seeing that throughout the life cycle, disordered eating is becoming a full-blown eating disorder. Or for people who developed an eating disorder in adolescence, it's then popping up again later on. So, you know, the bulk of our clients are in their 20s, but we have a lot of clients coming in also in their 30s. And then we have a number of clients who, after a divorce, after a child, after menopause or during menopause, at these very key times in their life, we're seeing disordered eating that was subclinical is now becoming a full-blown eating disorder. So in response to your question, I would say that we feel that screening at all ages would be helpful. What is your relationship with food? What is your relationship with weight? Are you preoccupied with body image? Might be some, you know, how much of your day, how much of your day are you worried about calories and weight and body image and exercise? Is it becoming preoccupying for you? Is it causing you distress? Those might be a couple of really, and you know, gosh, our internist doctors, I mean, I take my hat off to you, because in a very short period of time in your meeting, you've got to cover so many things. But that relationship with food and body image would be a key one. And I would suggest for men and women, or all genders, of course, all genders, because now stats are suggesting for guys, it's, you know, the levels are estimated to be, in the population, are estimated to be 1 in 4 of our guys, 25%, you know, and I think we're going to see that increase further. You know, for guys, it's the bigorexia. For the women, it tends to be a desire to be smaller.
Yeah. But I will say this: I've seen women in their teens to women in their 90s. They never cease to worry about weight. They never cease to worry about weight. And once they get past 80, it's like, how do I get on some weight? I want to look little. Everybody wants to look younger, because when you get older, you shrink, you shrivel, you look much older when you're smaller, and you want to fill out. And when you're younger, you want to get thin. And then when I see the other one part is where they start focusing on certain foods. Like, for instance, I am plant-based, but I'm plant-based. I have certain reasons why I'm plant-based, but
let's say somebody eats an egg, I don't judge them. And if there's by mistake egg in my food, it's not like the end of the world for me, right? It's like, oh well,
Yeah.
today it's there, and I'm not going to die because of this. But we have, this is where I think the disordered eating becomes a very gray area, because some people feel very strongly about, say, animal rights. That's one. The others would be people who feel very strongly about ketogenic, because there's so much research coming about ketogenic diet. I'm just going to eat fat because that's the only thing that has helped me over the years to lose weight. And if you look, no culture in the world eats either only plant-based or only fat. And yet it's a part of our social norm right now. And then the AIP diet, none of us know how our ancestors lived, but we're trying to jump to conclusions as to how they may have lived, that they ate only meat and very little carbs, kind of a thought process. So we're a species that's extremely confused about our food, right? Food choices.
That's well put.
Yeah. I don't think the tiger has a confusion. The elephant has a confusion. Cow doesn't have a confusion. So we confuse the cow, of course, because we raise them, and we kind of confuse our dogs. We confuse our cats. But how does one get to realize that they have a disordered eating? Is there something that they could be, maybe what I'm doing is not normal? Is there a way they could have an awareness?
It's difficult in the respect that it's so normalized that, and if you compare yourself to others, you can say, well, everyone around me is doing this, so this must be normal. And that may be true that everyone around you is doing it, but it doesn't mean that it is the most balanced, healthful way to be. So I encourage anyone to ask the question of themselves: how much of my day am I spending thinking about calories, food, weight, exercise? And really think about that. And is it a constant thing that's going on in the back of your mind, or is it something you think about when you get up in the morning? You go to the bathroom, you pop yourself on the scale, you look at the scale, you go, whatever, but then you move on. Or do you put yourself on the scale, you see a number, and your whole day is then about what you saw on the scale? And if the whole day is about the number on the scale, that tells us that this is causing you a great deal of distress. And so therefore you're at higher risk for disordered eating, anxiety as a result of that, body dissatisfaction, and psychological distress. That's okay. Absolutely. And if you put all of those elements together, we know, and I'm sure that you know, that those are actually factors that really chip away at your, not just your medical health, but your psychological health as well. So really, I would encourage listeners to ask that question: how much of my day am I spending thinking about calories, weight, body image, the scale, exercise, and what I ate this morning, and therefore what I should eat later? And many people may say, well, all the time, but that's just normal.
Yeah.
All the time tells us that this is maybe a little bit problematic. And the comment that, well, everyone else is doing the same thing is probably true, because it's this normative discontentment. But that doesn't mean it's okay. That doesn't mean that is that you should live that way.
So another way to think about this, as you were saying this, it occurred to me, if somebody thought about alcohol from the time they woke up, alcohol during every moment of the day, you would be easy to label them alcoholic, right? You just replace food with alcohol, and it's the same thing. If you're constantly worried about it, and you're almost starving because you don't have the specific type of food you're looking for, there might be a problem.
Yep.
And so that's interesting. And there's a beautiful book that came out. I don't know if you have heard of it. It's called Untamed by Glennon Doyle. I think it'll be a worthwhile read for most people. So she's an author, and this is really almost like her autobiography. It's called Untamed. And she talks about how a lot of women, I think men are also getting told now, but women in particular are told what is ladylike, what it means to be a woman. What should be your size? What should be the size of your buttocks, your bosom, whatever you want to call it? How long should be your hair, and how your skin should be? So all of the marketing is geared towards women. And when I buy clothes, I find those clothes on women who are stick, like, they're like, it's almost, you can wrap it around a tree and it's going to look fabulous. But when I buy it, it's different. Now I'm curvaceous, and when I wear it, it's not going to look like that. So our whole body image has been distorted by, number one, marketing. Number two is, of course, people who we look to, we are a big fan of, whether it be the artists or actors. I mean, one of the things we have to remember, somebody like Jennifer Lopez,
J-Lo.
Yes, she is in her 50s and she looks fabulous, but she works out 6 hours a day, but that's her profession.
Mm-hmm.
That's not our profession, right? And yet we look at her and think that's how we're going to have to live. So there's a lot of distortion of what is health and what we should look like other people are telling us. How do you help someone understand that the social media, this marketing, this consumer messaging is very different? They're trying to sell us something, and we get to be comfortable in our own skin. I mean, and then also be healthy and comfortable, right? So you don't want people to be eating. That's the other part. The other extreme is where I don't fat shame me, right? That's the other part, where you don't want to fat shame someone, but at the same time, if a person is having a health issue because they're binge eating on the wrong things, and then we're not supposed to tell them. I've had patients, when I used to have my traditional medical practice, get upset when I told them, hey, you've gained 10 pounds. It's like, I mean, you didn't have to bring that up, kind of a thing, but we're looking at it from a health standpoint. And I know that they're drinking pop or they're eating fast food. So that connection, it becomes really very murky to actually help them with their health and push them to the brink of disordered eating and then becoming an eating disorder. How do you differentiate all of that, and how do you help people?
Yeah, absolutely. There's so much there, isn't there? So to start with the piece around marketing and the thin ideal, if I start there, you're absolutely right. And as far as the imagery that is portrayed, that is a part of what we consume as consumers, right? Social media, magazines, TV. If you look at the ideal image, and our brains, by the way, are designed to compare ourselves. We compare ourselves to others. Our brains are actually wired to do that. And so what happens, as you rightly are saying, is that we look to someone that we can relate to. So in my case, a woman of approximately my age, of, my background, etc. And I look at them, and J-Lo being an example, and we probably feel a great deal of body dissatisfaction when we see that. And so because we see that and think that's what I'm supposed to look like, and that is what is desirable and lovable.
Yes.
And that's the ideal. And it's so grossly distorted because, as you said, this is what, the people that are portrayed on social media or magazines or movies, this is their full-time job, is to apparently look that way. And also, marketing is at its best when marketing makes you feel bad about yourself and creates an insecurity so that you want to buy a product to help address that insecurity, right? If you think about cosmetics, that's the whole premise behind it, skincare, etc. And so we have to remember that the goal of marketing generally is to create a sense of insecurity. And if we look at, therefore, at the health and wellness or diet industry, in America last year, we spent over $60 to $70 billion just in America last year on health, wellness, and diets. So there's a lot of money to be made on making people feel very insecure about their body shape and size. So I'll just say that, and hence the next diet that comes out. Now it's keto, but it used to be Atkins and all the different ones before then, and there'll be many more after, because it's profitable. So I think that's the first piece. And then, and so actually going back to that idea that we're actually wired to compare ourselves to others, but what we're comparing ourselves to is an unattainable, often photoshopped image,
That's
or
true.
a heavily curated image that may actually be completely unrealistic and unattainable and not even real. So what we tell our clients to do, and I tell everyone to do, is just unfollow so many of any type of social media feed that you're following that makes you feel bad about yourself. Unfollow it. It's actually subliminally, or not even subliminally, it's actually hurting you. It's toxic. It's making you internalize something that is not real. So that would be the first piece there. And then the second piece around a client that comes in to see you and maybe their weight has trended up and you're trying that delicate dance or that delicate balance of, hey, we've seen a little bit of a weight gain here. Are you aware of that? But also let's be careful, right? Because we don't want this to continue if you're not aware of it. And also, are there ways that you might be able to maybe drink a little less soda, or I tend to go more in the direction of, instead of saying less processed food or less of this, I tend to go in the direction of, are you getting in enough fruits and vegetables? What's your fruit and vegetable intake? What's your water intake? And once you're getting in those servings, whatever you have left over, go for it with the soda or the processed food or whatever. I don't say it exactly like that, but the idea is push out or reduce the ability to consume these other things, which are often being consumed because of, look, I get it, convenience, everyone's hurried, it's grab and go, I just don't have the energy to cook, I don't like cooking, whatever it may be, it's cheaper. Some of these fast food foods are ridiculously inexpensive. So that's where I try to go with that direction, and also definitely encouraging just a little bit of joyful movement or a little bit of walking, because small behavioral changes can make such a difference on preventing further weight creep, but also on, even at the same weight, you can improve your health profile. Even if you don't lose weight, you can actually improve your health profile by, more fruit and veg, so more nutritious food, more sleep. We don't want to forget that one, which helps with cortisol levels, etc. Appetite hormones are all regulated on circadian rhythm to a degree. A little bit of extra movement, maybe just walk a little bit, an extra block or so, and a little bit less of that social media comparison. And if you add all of those pieces together, it can actually have quite an impact on someone's sense of self, how they regard themselves, their own dissatisfaction, and hopefully improve health.
Perfect. Yeah. So I think that's really the key. The other part that you said is where you can improve your health without really addressing the weight issue. Initially, as you change that, it takes truly, as since you said biochemistry is your passion, or that's your foundation. One of the things that people don't realize is we learn reaction by reaction when you go to medical school, but the body, the cell, has a trillion reactions that it's undergoing as we make those changes. So when you make a change in the direction of health, you'll find the results of that journey a year later. Sometimes it's not as instantaneous as I ate a kale salad today and tomorrow I'm losing 5 pounds. It doesn't happen that way. The body begins to assimilate those nutrients and begins to shift everything, and you want that slow, steady, sustained change in your health profile. And the weight is always a side effect of you getting healthy or you losing your health, right?
Oh, I love that you said that.
Yeah.
There seems to be an echo on my microphone. I'm so sorry.
Oh,
I love that you said that, Dr. Chellam. The weight piece is a side effect of these other factors.
yeah,
And that is not the messaging that's out there right now, unfortunately, which is why we find there's so much disordered eating and so much diet culture out there, which we know unfortunately has, some pretty significant adverse side effects with yo-yo dieting, weight cycling, etc., and great distress. So I just love that you said that.
yeah.
The other thing I was thinking as you were saying that, and I know that one of your earlier episodes actually touched upon this, but gut health.
Hmm.
And so, while we're talking about can we increase fruit, can we increase vegetables, we're actually talking about increasing fiber. And fiber, this is something our mothers and our grandmothers used to tell us, right? Eat more fruits and vegetables. It's not a sexy diet. It's not one I could make a lot of money with a book about, but actually it's the simple stuff. And those foods, not only do they have many of our vitamins and minerals in them, but also that fiber, which promotes the so-called good bacteria in the large intestine. And there's a lot of research now around how that can then affect mood. And if you're feeling better, you're also more energized to want to continue to some of these steps that we've just spoken about. So your idea that one thing actually begets another and begets another, and it is a journey over time, but each step actually lends itself to things being a little bit easier over time. And so, I can't emphasize that enough, that some of these small things can actually have a huge impact.
Absolutely. And I think it's also a very important message for people to understand, even though I'm sure you've heard this where people say, I've not changed my diet, I've not changed my exercise, but I've just suddenly gained 30 pounds in the last 6 months. Now that usually is a medical condition. A lot of
Yes.
times it's
Yes.
usually a medical condition. Your thyroid may be failing or something may have shifted, or years of eating poorly may have finally caught up. I don't know what happens, but there's usually a hormonal shift when that happens. However, I think most of the times people need to realize when you've had a weight issue, it has been a journey to have that. And it'll be a journey to get a permanent reduction of that particular problem. And that's why that's why we have so many weight loss programs in this country. And yet we are the heaviest nation probably across the world, because we're targeting weight and we're targeting, and when people call my office also, they ask me for weight loss, I tell them you got thousands of programs. You can go to any one of them. For us, our focus is, why do you have the weight? Is this a part of your disease process? Or is it a part of your hormonal dysfunction? Is it a part of your gut dysfunction? Or is it simply a part of poor eating habits? I don't know. And that's for me to discover from your history and your blood test. And when we address what the underlying problem is, the weight just goes away. So I think it's very important to understand it's a journey, and it doesn't happen overnight. So in your experience, what has been the journey? Like how long, and what are the stumbling blocks people with eating disorders and disordered eating? What are the different stumbling blocks? I'm going to assume the disordered eating is a little harder because it's more normalized, whereas eating disordered people usually have an underlying depression or anxiety and are aware that they have a problem. So help me understand the difference between the two, and who is more difficult to work with.
Absolutely. That's a great question. You're correct in that the higher the level of acuity, so clients who come in meeting the diagnostic code for an eating disorder, it's massively disrupting their life. So honestly, at that stage, they feel as though they have no other option but to go into treatment and try to treat this and deal with it, so to speak, which actually takes a lot of courage to do. Disordered eating is so much harder because clients don't even realize that they have disordered eating, and they will come in and just say something about, I'm distressed about this, or I lost some weight, or maybe I gained some weight, and can you help me get back to whatever my weight was? And so we have to slowly but gently undo all the messaging and all of the internalization, because the biggest thing, because of our society right now, which is very focused on the thin ideal, And as a result of that thin ideal, we're very, very fearful of fat and being fat. And I use that word in a very proactive way because there's a real reclaiming of that word to try to neutralize it instead of it being judgmental, if you will. So there's a real fat phobia actually in our society. And so clients come in and they're very fearful of gaining weight and being fat. I say that in inverted commas, according to themselves. So you're right, it takes a lot longer to gently pull back all the layers because it's about the beliefs and it's about what is my family doing and it's about the messaging and all my friends. And when I go to the office, everyone's talking about diets. So it's a real education around reversing that lens and reversing that thought process. And the danger there, honestly, is that we can have clients who, because it's not at a point with disordered eating, it's not at a point where it's so disruptive to their lives, not yet. So they can work on it a little bit until it gets a little bit better. And so the pressure eases off a little bit and they're less distressed about it. And then they might go off into the world and be at that place of good enough, but not fully neutralizing their relationship with food. What happens there is that they're at a high risk of lapsing back into significant or the next diet, or let's say they have a baby and then they want to get off the baby weight and they do something very drastic and then it can really get really significant very, very fast. So you're correct in and the other difficulty is honestly disordered eating clients don't usually present as frequently for treatment, because we're not identifying it as a problem because it's normalized discontentment, you know?
Mm-hmm. Yes. So how do they actually find somebody like you, or how do you discover that, oh, this person has a disordered eating? Is it because they come, because I do have people who call us and say, I want to get on a plant-based diet, and they could very well be trying to just get healthy.
Yeah.
But that can lead to disordered eating if you're not careful.
That's exactly right. And actually, we see a number of clients who maybe have some kind of GI distress, maybe some food allergies or intolerances, and their allergist or their doctor, functional medicine doctor, maybe puts them on some elimination diets, and then things get crazy.
Oh,
and then
I
they
hate food sensitivity testing for that
no.
one reason.
Yes, and it's so not standardized, and the results I question. That is really tricky because and also this is where it speaks to authority figures, and particularly for yourself as an MD, you guys have a lot of authority, because when you tell a client, okay, well, you're allergic to 100 things, when that person comes in with that very thick, usually very thick report, all colored and bolded and lovely charts, and they present that to me and I say, gosh, wow, let's have a look at this. It's like, no, my doctor said that I'm allergic to these 100 foods, so that is the law.
So may I get on my soapbox on this?
Please.
One, please. So food sensitivity tests and food, this is rampant because every Tom, Dick, and Harry, including fitness centers, exercise places, can order one. All right? That's number one. Number two, then they give you a chart and say, you're sensitive to all of this. And then people begin to eliminate it and they never go back again for a food sensitivity. The problem is, as human beings, we should not be sensitive to something we grow and eat. If you are, it's a gut issue. It is not the food issue. And what happens is people start, anything that makes you contract your ability to eat and get nutrition is not the right thing. So I almost will do only food sensitivities when a patient insists, and I give them clear explanation. Every 90 days we have to repeat, and you'll find your food sensitivities keep changing. But you have multiple food sensitivities. The food is not the problem, your gut is the problem. Yes. That's when you need a medical doctor, or I shouldn't say medical doctor, I should say a doctor who is trained in functional medicine, who can actually work with your gut issues, and then the food sensitivities does not become an issue. But stop doing food sensitivity testing and thinking that you're sensitive to those foods for the rest of your life. That I have to get that out there.
I wish we could shout that from the rooftop. That is just, my goodness, absolutely. You know, you're the voice of sanity there. You're absolutely the voice of sanity. And it's causing enormous problems because, as you're rightly suggesting, what we're seeing is that clients will often drop weight and then they'll get very obsessional. And they may already have obsessional type traits in their personality anyway, and it gets exacerbated. We also, in our profile of our clients, is high anxiety, 70 to 80% of our population. So when you combine all of those components together, you've got a real high-risk situation for someone ending up with disordered eating or an eating disorder, and that honestly could have been preventable. And what happens though is, as a client starts to lose weight, their brain changes. And the rational part of the brain, the prefrontal cortex here in the front of the head, literally, basically goes offline. And the part of our brain that is involved with fight, flight, flee, which is the fear-based part of our brain, tends to drive more of the emotions and the thinking. So you're coming from a place of high anxiety and high fear, and not being able to rationally look at the data and understand the pros and cons. And therefore there's more rigidity and black and white thinking, and more of a desire to hang on to what you've been told about this testing. What we see also with the way that eating disorders and disordered eating hijacks the brain is it can be quite convenient. I say that in inverted commas because this is an illness. It can be quite convenient for our clients to have 100 allergies because it means that those foods are off limits, and so they have like a legal
pass to not to eat.
Exactly.
Okay.
So it's easy to then say at any kind of public functioning, oh no, I'm allergic to those. My doctor told me I should avoid those foods. So no, I won't be eating today, or I'll only be eating my kale. And so there's a lot of smoke and mirrors that can conveniently go on. Again, not suggesting that our clients are deceptive, but the way the illness functions in the brain can lead to deceptive behaviours or convenience in this case. So there's a lot there, Dr. Chellam, but I love that you're such the voice of reason there around that allergy testing.
Absolutely. And I think most functional medical doctors who actually learn this know that the food sensitivity testing, multiple food sensitivities, really is a mark of gut health and not an issue with trying to eliminate the food. And that should be something that people need to get to know. So having said all of this, because our world, no matter how you spin it, is about social media, is about diets, it's about weight, it's about how you look. And that's a fact. We can't change that. And I always say it's like each individual just needs to have that awareness and check themselves. If they're struggling with something, reach out for help. But what would your advice be to someone who is really not certain that they have an disordered eating? And before we started the podcast, we had this conversation where I told you some of my patients who go on a plant-based diet will not touch oil, and their testing shows their omega-3s are low and they really need a little bit of good fat, and I can't get them to eat any of the fat because a lot of the plant-based gurus out there, our celebrities, talk about no oil. And I'm fine with no oil, but no fat is not a good option because there are essential fatty acids, there are essential amino acids, but there are no essential carbohydrates. Right? Because carbohydrates is ubiquitous and we need to get those in a certain amount. How does a physician help a patient, or even call out somebody, hey, you may be having a disordered eating and maybe you need some help? Or how does a patient who's listening to this and saying, well, this is what I've been told, like we should be a whole food plant-based and there should be no oils. Am I having a disordered eating? How would you help them get that awareness and seek out help?
Absolutely. It's a great question. And I tend to not I don't even use the word disordered eating because I think it can scare people.
Yeah.
But, you know, really talk about the fact that even with that they've adopted this way of eating, which is very which is to be congratulated because they're trying to do something for their health. So that's really great. There are a couple of key things. You know, I'm using verbiage here. I would say to this client that there are a couple of key things though, because that I'm afraid are missing in your eating that are essential. And essential means that you can only get them through food. The body won't make them. And if you're not eating them and consuming them through your food sources, then there are certain systems in your body that are going to come to a halt and not be functioning optimally. And that could set you up, unfortunately, for some concerns, if not serious consequences. One of them being brain functioning with essential fatty acids, for example. So talking about essential nutrients, and the balance of the macronutrients. So the macronutrients, you know, you mentioned we've got fats, we've got protein, and we've got carbohydrates. And carbohydrates are a fuel source. And without carbs, you're going to get really cranky, you know, et cetera, et cetera. I know there's a lot there on keto, but nonetheless. And so because, you know, a lot of people don't know the basic nutrition. And as you said, we're listening to gurus. And honestly, we're listening to a lot of people who don't actually know the food science. They don't know the food science. They did something that it worked for them, but it doesn't mean that it's actually balanced. It doesn't mean it's the right way to be doing things. And so I think talking about, in the same way, like I think most people get the idea of vitamins and minerals, but they don't necessarily understand essential nutrients, essential amino acids we know in protein, which is why with vegetarianism or veganism, we need to just have a consideration for where are you getting your protein from, and not Googling it, not the Google University, because there's a lot of 80% of the information on social media is either misleading or incorrect around health and wellness. So it is essential to talk to someone who actually understands the chemistry side of this. And the fatty acids to I would link it to the brain and say, you know, there's essential fatty acids that you can only get through eating fat. And fat is actually not this hated, horrible thing that we think it is. It's actually essential for skin health. That's a big seller. Hair health, but also brain health, right? You know, because you know, being a doctor, but all of our hormones are made from fat. I mean, it's just essential. So using that word, maybe essential nutrients, that may actually be the education that may be missing for our clients. And speaking of it in that way, as opposed to, and I know that, you know, you would be very sensitive to this, as opposed to saying, gosh, I think you've got disordered eating. I mean, clearly it's disordered and clearly it's out of balance, but we can just use more of those kind of terms. You know, you're missing some key essential nutrients, just like, and it's like medicine. If the body doesn't get it, then you're really in trouble.
And this is the other thing that I would tell people. We live in a world of information. We live in a world of noise, and we live in a world of chaos. I see, you know, 16, 19-year-olds making great videos that look like it's backed by science about weight loss, about diets, and so many things. It's amazing. YouTube is like a wealth of information or misinformation. And the other part that is also important, which I have noticed in my practice, though I can validate it through any of the studies, because most studies are done on middle-aged Caucasian men. So it's very difficult for me to extrapolate, but I find the same things that work for a man do not work for a woman.
No.
The hormones are so different, and yet women struggle to lose weight trying to do what a male fitness coach or a nutrition guru is talking about. I see in my own practice, if a husband and wife joins, the husband will easily lose 40, 45 pounds doing the same thing, and the wife will hit barely 50% of what he does. And that's the nature of how our physiology is set up. It's not like it's bad or good. And so learning from people, like you said, it may have worked for them, it doesn't mean it's going to work for everyone. And we all have a unique biochemical blueprint, and then our environment triggers it on or off. What you have to see is, what is your biochemical blueprint, and is it in cahoots with the environment to promote health or promote disease? And I think that's where all of this comes, and that's where a team, like as a registered dietitian, not all registered dietitians know what you know. This is something that also people need to understand.
Yes.
So how do they find somebody like you and say, you know what, I've tried every possible diet in this world, but I just don't seem to be making it? What is your advice to them? How do they find you? And what are their next steps?
Absolutely. So next steps is to come and find me on my website, which is balancedtx.com. So that's balance with a D, tx.com. And actually there's a calendar on there, and you can sign up for a free 20-minute discovery call where you'll get a chance to speak with one of my therapists, actually. And we can help you figure out, is what I'm doing problematic, or am I overemphasizing this or making too much of this, or is this actually serious for yourself or maybe for a loved one if you've observed some behaviors in their relationship to food and weight and body image that you think, especially right now because we're living in close confines with a number of our family members. Give us a call and we can definitely kind of walk you through that. And very, very happy to be of help. And the other thing I would also like to leave you with, Dr. Chellam, for your listeners, is we have a free downloadable book. It's called Redefining Wellness. It's actually an anti-diet book. So it's about all the different ways that you can feel better and be healthier. That is not about being focused on your weight.
Yeah,
that's actually a free downloadable, and that was actually a response whereby we pulled from about 150 people in our community, in our eating disorder world. So it's written by mostly professionals, and that was our response to the massive amount of diet culture that's out there, right? So they your listeners can certainly check that out as well, and certainly give me a call via the website. And we'd be happy to sit down and chat.
That is awesome. This conversation I could have forever and for hours together, because it's a very important topic. And I think people need to be aware, because everybody wants to get healthy, and nutrition is a huge pillar in the health and wellness journey. But understanding nutrition, there is a science behind it. It is not just about a diet. Diets never worked, and that's why we have so many of them. And it's almost like the same thing gets spun different ways.
Yes.
So the message you bring is extremely important, and I thank you for actually doing this.
Oh, thank you so much, and thank you for allowing me to be on with your listeners to be able to have this conversation. So thank you, Dr. Chellam.
Thank you very much.